Hi, I'm Sarah Cruickshank and I'm a veterinary physiotherapist from Vet Physio Limited, and I'm going to answer a couple of questions that have been emailed in to us for this webinar. So the first question was from Jan in Canterbury, and she'd like to know about the use of the marine gels on her horse's pelvis. So he's got a slight asymmetry behind and quite a lack of muscle across his sacroiliac and into his glutes up here. So definitely, Jan, after you've worked him, it would be really beneficial to massage some all black and blue into the gluteal area, up over the sacroiliac and the lumbosacral region here and onto the other side. The all black and blue really helps with pain and inflammation, and it's great for after exercise. So I think with your horse, he certainly needs to build up more muscle tone and strength across the area. And you need to make sure that he's not got any pain in his sacroiliac or lumbosacral region, and then it would be a case of long, slow, steady conditioning to build up that muscle tone. Perhaps talk to an equine nutritionist to ensure that he's receiving all the protein and fat that he needs to build that muscle. But I can help you with a program if you need something a bit more specific to help build him up. But certainly using the all black and blue after your exercise session would be really beneficial. Your second question was how to look after tendons and windgalls in Canterbury. So I think definitely if you can access the beach, riding them and walking them through the water is hugely beneficial. After you've ridden and worked them, they can get quite hot in their exercise boots, which are great for protecting the quite delicate tendons from bangs and knocks. But whip your boots off as soon as you've finished your exercise session, because their legs and tendons do heat up with exercise, and then obviously more so with boots on. We know the core temperature of tendons gets very high when they gallop. So after you've exercised, whip the boots off and cool the tendons down with some cold hosing techniques, and then you could rub some all black and blue into the tendons after you've worked and you've done your cold hosing. So the second part of the question was on windgalls, which are swellings through the deep digital flexor tendon sheath, which appear on the inside and the outside of the horse's leg. Sorry, this horse is quite muddy and hairy. It's the middle of winter. Windgalls tend to be an incidental finding. They're not normally associated with lameness, but they can be a swelling with tenosynovitis, which would be something that your vet would treat. But generally, they look unsightly, but they're not going to affect your horse's function. But looking after their legs, maybe doing more uphill work in the summer when the ground's hard, to minimise concussion. Definitely doing some work at the beach and in the water is really beneficial. And just looking after your horse's limbs, always mindful of the surface and how much strain you're putting through their legs. But again, feel free to email me if you have anything more specific. Hi, I'm Sarah Cruickshank, veterinary physiotherapist, here again with some more questions. So this is a canine question from Margaret regarding her corgi Oscar, who had a paw issue in front, and then that resolved, or was starting to resolve, and he's lost the use of his hind limbs suddenly, but he doesn't seem to be in any pain. So she's asked two questions. The first question is, he's bright and he seems pretty happy, should we put him down? And the second question is, what kind of condition might it be? So I'll answer the second question first. So from what you've described, I would say that he probably has degenerative myelopathy, which is common in German Shepherds, Rhodesian Ridgebacks and Corgis, where they actually get degeneration in their spinal cord. So it's not extremely painful, like when they lose their loss of their limbs or become paralysed from a disc prolapse. So his spinal cord is degenerating, which means the messages from his brain to his limbs and back up to his brain to tell his brain what his legs are doing, the messages are not getting through, essentially. So he's lost the use of his hind limbs and is quite shaky. So that's what I would say the condition is. Obviously your vet will do a full range of tests and make a full diagnosis, but if it is degenerative myelopathy, the best thing for that is physiotherapy. So there's not a huge amount that the veterinary treatments can offer, so medication isn't hugely beneficial. So the main thing is keeping his muscle tone and his range of motion in his hind legs. So what we would do is some supported standing work and then also some range of motion. So doing some cycling with his back legs, some stretches, stretching his legs forward and out behind him, slightly awkward position here, and also just keeping his toes flexible. So if he's not standing as much as he normally is, then his toes will get quite tight, so just doing some toe stretches. The other thing would be to use a towel and make it into a long sling and use that under his belly and get him walking. So the other thing we could do is fit him for a harness that's got a handle, and you can help keep him walking and ambulating as much as you can. The more he's able to walk, even with assistance, then he'll maintain his muscle tone and muscle mass for longer and maintain his function. So to go back to your first question, if he's bright and happy, even if he's losing the use of his back legs, he doesn't need to be put down yet. I think he's still got some life left in him, and the main thing would be managing him, ensuring that he's comfortable and he can still do all the things that he wants to do. If he needs a little bit of help getting around with a harness or a sling, that's fine, and just maintaining his muscle mass and range of motion. So I hope that answers your question, and I can help you with a program for Oscar more specifically once you've just confirmed that diagnosis.